Come in.
Hi, my name is Jaden. I'm going to be your student nurse today. I'm going to provide privacy, perform hand hygiene. Can you start by stating your name and date of birth?
I'm Sonia Washington, and my date of birth is September 27th, 1987.
Okay. And can I check your wristband?
Absolutely.
Okay. Alright, and I'm going to verify my orders. It looks like we're here for a head-to-toe assessment, okay?
Okay.
Alright, I'm going to start out, and it might be silly. Can you tell me where we are?
We are in the clinic.
Okay, and can you tell me what the day is?
I believe today's Friday.
And what year are we in?
2025.
And, alright, so I'm going to start off with your head, and first thing I'm noticing, your skin tone is even consistent with your ethnicity. I'm not seeing any lesions. Alright, I'm going to check your eyes. I'm going to first start by measuring your pupil size, and you were sitting at about a 4. Alright, I'm going to flash you in the eyes with a light, okay?
Okay.
And it'll be a little bright, just look forward. Alright, eyes are good. Your pupils are equal, round, and reactive to light and accommodation. Now I'm going to check your ears. Is it alright if I touch your hair?
Yes.
You need to hear that. And I'm gonna... Ears look good. Alright, I'm not seeing any signs of drainage or anything like that. Now I'm going to check your nose. And that's all good. And your nose is symmetrical, midline your face. Can you open your mouth and say ah? Alright. Okay, and I'm going to check your throat, your trachea, okay?
Okay.
Can you swallow for me? Okay, trachea is midline. I'm going to ask you a couple questions. Have you noticed any loss of hearing?
No.
Any trouble with like blurriness or trouble seeing?
No.
Have you had any issues with your nose, such as like drainage?
No.
Okay, and do you have a sore throat?
No, not today.
Good. All right, now I'm going to do the cardiac portion of this assessment. I'm going to listen to 5 spots on your chest, and then I'm also going to check your capillary refill and on your fingers and toes, and then I'm also going to check for edema.
Okay.
Starting at the aortic, and the pulmonic, and then coming down to Erb's point, and then can you lift your breast up for me, please?
Yes, ma'am.
Tricuspid, and then mitral. Okay, that all sounds good. If I would have heard any abnormalities, I would repeat that entire the entire cardiac exam again, but with the bell of my stethoscope instead of the diaphragm. All right, I'm going to check your fingers. Check for edema. I'm not seeing any signs of it. Capillary is less than 2 seconds in upper extremities. I'm going to check your feet. Alright, less than 2 seconds for the capillary refill and no signs of edema. While I'm down here, I'm going to check your dorsalis fetus pulses. And I'm also going to check your posterior tibial pulse. Good. Alright, now, have you had any chest pain?
No.
Any family history of heart disease, hypertension?
No.
Alright, now I'm going to do the respiratory assessment, okay?
Okay.
I'm going to listen to 4 places on the front anteriorly, which just means front, and 4 places on your back, and then 2 sides, 2 on your sides.
Okay.
When I put my stethoscope down, just take a deep breath, okay?
Mhm.
You just lift your breast, please. And the same over here. And then can I have you put your arm across? Deep breath in. Same over here. Okay. And now can I have you turn to the side and I'm going to check your back. Deep breath in. Okay. It all sounds good. Have you had any shortness of breath frequently?
No.
Alright. Have you had a cough?
No, not recently.
Okay. So, if you were to have, if the need were to arise, which it's not right now, we would use this thing called an extended spirometer. And what you do is you would put the nozzle in your mouth, inhale, hold it for 2 to 5 seconds, and then release. And you do it 10 times in an hour.
Okay.
Can you repeat that back to me?
Yes. So I would take the incentive spirometer, place it up to my lips, take a deep breath in, 2 to 5 seconds, release, and then I would want to repeat that 10 times about every hour.
Yes. Good job. Alright, and now I'm going to check your gastrointestinal, your gastric sounds.
Okay.
Could I have you lay back for me?
Sure.
Now, what I would typically do at this point is have the patient lift their shirt up so I can inspect for any striae, any scars, any lesions, anything abnormal. But we are going to simulate that I've done that. And now I'm just going to listen to 4 quadrants, okay?
Okay.
Alright, and I'm just going to check the vascular sounds. Alright, you sound good. I'm not noticing anything out of the ordinary. If I would have heard something out of the ordinary, I would have repeated the exam with the belt of my stethoscope again. Now I'm going to palpate all 4 quadrants and I'm just feeling for masses or anything out of the ordinary. And I am not feeling anything. You are good to stand up. Or sit up. When was your last bowel movement?
This morning.
Okay. And have you had any trouble urinating recently?
No.
Okay, good. Now I am going to check your musculoskeletal. I am going to have you, can you hold your arms out like this and then flex them up and extend them back down. Okay, and I'm gonna have you do that while I'm holding your joint, okay? Okay. And this one. Okay. Alright. And then can I have you hold your hands out like this? Alright, I'm going to have you hold them up, back down. Okay. And I'm gonna hold your joints while you do that again. And down. And then back up. And I'm not noting any signs of crepitus or anything like that while you're performing those. I'm also going to have you with your knee. Can you flex your knee back?
Yes.
And then back down. And then can you do it with this one? Over here. Okay, good. And then with your foot, I'm gonna have you, can you point them down, ankle, and then up, and down. And can you repeat it with that one? Down, up. Okay. Alright, and I'm also going to assess your gait. Can you stand up and just walk towards me?
Yes, ma'am.
Alright, and I'm gonna have you walk back to where you were. And your gait is fine. Walking is normal for what we would expect to see. Alright. Have you had any joint pain? Any problems with that?
No, ma'am.
Okay. I believe that is all. Do you have any questions for me?
No, I think that's everything.
Alright, thank you so much.
Thank you.